Before we get into what is changing in the world of fat transfer to get a more hourglass shape, could you tell me about someone that you had to turn away back in the day, someone who wanted a BBL or a breast enhancement through fat transfer, and you simply couldn't help them because they didn't have enough fat? What did that conversation look like?
I'll tell you that that conversation has happened so many times in the past, and it's not that we didn't do anything. There was other options that we used to use, such as biostimulants, maybe some targeted HA, maybe some other things. And the problem is a lot of those results were very expensive. They had mixed results. They had limited enhancement. So, it was always challenging to offer something that didn't maybe give patients the results that they loved or hoped or wanted. So those things were a little bit challenging. I think now that we can offer somebody that I feel really great about, people have had great results with, that's super exciting.
Dr. Franco has performed thousands of fat transfer procedures, BBL, breast enhancement, body contouring, and has seen firsthand how many patients fall through the gap. They want hourglass results. They don't want implants, and sadly, they don't have enough fat to transfer. Although there were other options, it's nothing like what's coming on the market today. He's now working with a company that is solving that exact problem, and he's one of the first surgeons in the country doing it. Coming up, he's going to tell us what that solution is and who it's actually for. Dr. Franco, welcome back to Beauty Seek.
Thanks for having me. Super exciting topic.
Dr. Franco, some call this new procedure the zombie butt, fat in a can, or just body filler. On a scale of 1 to 10, how accurate are these names for describing what it actually is?
Gosh, probably like a 9. So I mean, I would say pretty good. This new product, alloClae, it's a processed donor fat, so it does come from cadaverous people who designated their body, honestly, for aesthetic procedures. But what's really unique about it is it's 60% adipocyte cells, 40% extracellular matrix. We've never had an off-the-shelf product designed specifically for the body. And if you think about it, now that we have something that was designed specifically for the body, it enhances the type of things that we're looking for, especially when we're talking about the butt and hips. We've never had a large volume filler. We've never had something with this kind of strength to be able to sculpt and shape. And I think that's why the results have been so exciting for so many patients.
And traditional fillers, they last months. Fat transfer results are largely permanent once the fat survives. 1 to 10, how long does alloClae last?
A great question. I can't say that we 100% know, but I would say probably it's going to end up being like an 8.9. I was fortunate enough to be part of a clinical trial. What's super exciting about that is that we actually looked at the longevity of alloClae. They did 5 sites around the country, world-class plastic surgeons from all around the country. And we measured them at various time points. Actually, the 6-month data is just being released that showed almost 85% retention of alloClae at 6 months. And this is laser measured all the way around. And then the 12-month data, everyone's already been completed in the study. That results will be coming soon. I think that's going to be well over 80%. That's what we saw at our site. So, I mean, to be able to see this. And then what's more interesting is we actually looked at these patients at time points along this with the ultrasound that we talked about during the BBL segment. And what we saw after about 4 months is that you saw that the product started to integrate. And so you, at the beginning, you could see that alloClae product. Over time, the result was stable, but you couldn't see any more of the alloClae product anymore. It looked like your own fat. So the concept behind alloClae is that you've got this scaffold with this extracellular matrix that's causing stimulatory effects of your fat to integrate. So now you are causing, this ingrowth, and the goal is to create your own fat scaffold that's going to give you a natural result that's going to last for years and years to come.
Wow. I looked on the website before having the interview here, and it mentioned something about the importance of this honeycomb effect. Is that sort of what you're talking about, the scaffolding?
Exactly. So that's the adipocyte cells that cause this honeycomb or scaffolding. And that's what gives you that lift and strength. That's what holds the shape while your body integrates throughout that scaffold.
Hip dips, liposuction irregularities, area where the surgery left something uneven. I imagine these are patients who need a small targeted correction, not a full BBL or breast lift procedure. 1 to 10, how useful is alloClae for these smaller kinds of corrections?
Oh, 10. I mean, I think for small hip dips, lipo contour deformities for these small areas, absolutely incredible. I think you're going to see an expansion into full BBLs, full breast augmentations over the future. No question, there's a price still associated with alloClae. It's a newer product. I think as that continues to decrease, which the company has done, I think you're going to see it become more and more widely available, and then be able to use for these other treatments.
Okay. I love that. I love talking about the future. And can we just step back a little bit because I did some research and I found when surgeons were speaking about this being donor fat, I don't think that there was clarity that this is donor from cadavers. So a lot of the beauty seekers were saying, "I'll donate."
Mhm.
So can you tell us a little bit about the process, if you have any kind of level of detail there, that how do they?
Yeah, so there is a screening process that goes. They have to meet a certain criteria. The fat is taken from abdomens of these people who have donated their bodies, and so they can take that fat, and then it goes through a processing which removes any of the nuclei, any of the cells that you would have a reaction to, and then you've got just those adipocyte cells, that extracellular matrix that gets processed because then it's made into a nice fine material that looks just like your own fat, right? Because it's those adipocyte cells, that extracellular matrix. Extracellular matrix is basically all the stimulatory effects, all the things that signal the skin rejuvenation, the stimulatory effects of these fat cells mixed into it, and that's what creates this really nice product that you can use for an enhancement.
Okay. I was talking to Dr. Sterry about facelifts and so forth the other day, and a little bit of fat transfer, and we got on alloClae a little bit, and he said it kind, it was kind of scary at first, but then when he dug in, procedures have been being performed with cadaver materials for years, right? So this is not really anything that is should be scary or considered that new, although fat is new, but like bones or cartilage, is that true?
100% it's true, and so we've used it for all sorts of things, for ribs, for other things, and because remember, when we try to do plastic surgery or even any type of orthopedic or other type of surgeries, we need these materials to help people heal, to reconstruct, to build and create that. So it's not a novel process. I think what's novel is the way they've been able to take these adipocyte cells, these fat cells, into a way that's caused this longevity, this shaping, sculpting. So that's what's unique.
Beauty seekers, here's what you just learned. If you want fat transfer to fill lost fat or enhance your hourglass shape, and you do not have enough of your own fat, there is now a solution. If you want fuller breasts without implants and do not have the fat to make it happen, there is now a solution. And if you've lost weight on Ozempic and feel like your curves went away with it, there is now a solution for that too. Dr. Franco, how available is this technology across the United States?
Honestly, it's become widely available. If you look at it, we're hosting trainings all the time. I know that some of the other centers are. So most likely, you can find a board certified plastic surgeon in a town near you that offers alloClae. So probably 2 years ago that was not true, but it's become very, very available now. So making sure though that you talk to somebody. I think the biggest thing is making sure you have realistic expectations. There's still, especially when we're talking about butt and hip dips, there's still a certain amount of product that's needed for that transformation. So I think that making sure that you're both super clear about where you're trying to get to.
Okay. And in terms of being really clear, let's be really clear. This is for a board certified plastic surgeon to be doing these injections, not necessarily an RN or an injectionist.
When we're speaking only about butt, there are some nurse practitioners, PAs that have gone through training that can do some of this. If we're talking about alloClae in the breast or some other areas, then should be done by a board certified plastic surgeon.
Gotcha. And they should be using an ultrasound device, correct? Or
For the most part, depends where you're at. I think in the buttock area, I personally think it's safer to use an ultrasound in most cases. I do think if you're talking about other places like lipocontour deformities, legs, abdomen, I don't know that you need an ultrasound for those areas. But we're talking about buttock projection, those type of things. I think you still need a good level of caution.
okay, great. Thank you so much. You took us on a journey today. It started with the waist, where so many patients have been told their shape is just their shape, and it's not. Rib remodeling can change that the same day with a procedure most people never knew existed. And then it moved on how to enhance that hourglass shape achieved by rib remodeling. Fat transfer can build the booty and enhance the breasts without implants using fat from your own body. And then you showed us what happens when the body does not have enough fat to give. And that for the first time, there's an answer for those patients too. You are a gift to every beauty seeker who thought they had run out of options to achieve an hourglass figure. Thank you.
I love this. alloClae is giving people options where they never had one. So that is super exciting.
It is exciting. And thank you for participating in that study. I mean, we need the surgeons to partner with the technology.
And there's more coming. We're actually doing a histology study where we're going to biopsy some people that have had alloClae about a year ago and look at the transformation. So, what we believe on these imaging, but now we'll actually have the real tissue to analyze and look at.
What is there a theory behind that? Like, we hope to see this, or you're just going to go?
Hope to see, because we're going to do some from kind of just normal tissue. The hope is that they look exactly the same.
Sweet.
I think over a period of time, you'll see some inflammatory effects. I think the further out, like we have someone who's almost 2 years out, the hope is that person, you won't see any of that. And, someone at a few months, you'd kind of see this gradient.
Exactly. Yeah. So it's the longevity of retaining the fat is so important. Then also what happens to it? How does it grow? Where does it go?
Yeah, exactly.
Beauty seekers, thank you. If you have not subscribed yet, please do. Every subscriber is how we keep bringing you surgeons like Dr. Franco, who is working with cutting edge technologies like rib remodeling, fat transfer, and alloClae. And thank you for being part of our community that believes you deserve to know what is actually possible aesthetically before anyone tells you no. Sarah, you train other providers on cellulite all over the country.
Have the cellulite. So no matter how much you squat, how much you work out, like you mentioned, I've got super fit women that still have cellulite. If we don't get rid of those bands, then we'll always have the dimples. Yes, long-lasting treatment. That's kind of the best way I can describe it. And that's a little hook release, and then everything can be nice and smooth.